You said that the asymptomatic people may live with it longer and may shed it longer. Does that mean they're more contagious than people who show symptoms, or the people who show symptoms are building up a bigger viral load and so they're more contagious?
Yeah, it's very unclear. First of all, it's unclear whether or not they're shedding live virus. And so in this study, and again, it was a small study, they shed virus for a longer period of time. Other studies have shown a similar thing. What's unclear is it live virus? If it's not, then it's not going to mix. It can't really spread the infection. But assuming it is live virus, so they're continuing to shed live virus for longer periods of time, the next question is, are they shedding more virus than someone who's symptomatic? And it also didn't answer that question. The only question it answered was that they're shedding some kind of virus for a longer period of time. So it suggests that they could be contagious for a longer period of time, but not necessarily that they're more contagious than someone who's very symptomatic.
Hey, Dr. Gottlieb, the CEO of AMC, the cinema theater chain, saying that they're going to, of course, reopen, but they aren't going to require customers to wear masks. The CEO specifically saying he doesn't want to, quote, be drawn into a political controversy. This after the president said that he believed that wearing masks could be signaling a political position against the president. What do you think of that?
Look, I don't think this is a political issue. There's very few things that we can do to try to prevent wider spread in another epidemic heading into the fall, and this is one of them. Universal masking is one of the simplest interventions that we can take that could probably reduce the odds that we have another epidemic. And so we need to reach for the least intrusive things that we can do. This is one of them. I think you're going to see people start to change their position on this. There's this sort of view that imposing masks on the public is somehow denying them their liberty. I think telling them they have to stay at home and they have to close their businesses is denying them their liberty, or that they can't get on an airplane. I don't think asking them to wear a mask when they go into congregate areas is denying people their liberty and their right to choose. And so you're seeing governors reverse themselves. The governor of Arizona is allowing local districts to now impose masks, require masks. Governor of Texas is doing the same thing. I think AMC is going to have to change their position when they find that nobody's showing up at their theaters.
Doctor, just to follow up, the CEO does say that they're going to sell masks. They're going to encourage masks. And even the CEO said that he would wear a mask himself, but he said that he was going to allow others not to if they didn't want to. Given the conversations we've had about masking and how my mask protects you and your mask protects me, would you go to a theater that doesn't require masks?
No, I wouldn't. And if you see what the airlines have done collectively is effectively require masks. And if people show up and don't wear a mask, they're not going to allow them to board a plane again. And so I think the theaters are going to have to do the same thing, because if you go into a theater and you're trying to be careful and you see people who are unmasked in the theater, you're going to be very uncomfortable about going there again. So I think that they're going to have to rethink this if they want to get people back into those congregate settings. That's a high-risk setting. Anything indoors with poor air filtration, where you're sitting close to people and you might be in a theater, those are higher risk settings. They're going to have to make some accommodation here.
How you do the popcorn at that point. Just like, if you can't have drinks on a plane, I don't know how you can have you need constantly. You know how people eat popcorn, too. I mean, it's like shoveling it in. I had one more question okay. Doctor, do the ICU rates in these states that we're worried about and the hospitalization rates, do they both indicate that it's more than just testing in terms of what we're seeing? That's, you can call it testing, saying that's why we're seeing increased incidence, but you can't, it's not going to affect the hospitalizations and ICU beds occupied. Is it clear they're spiking and it's worrisome?
It's clear they're spiking. Hospitalization rates are one indication of that, but also the rising positivity rate. So they're getting back a higher percentage of positive cases in all of these states. Even California looks like it's ticking up now as well. What we're seeing, actually, I'm going to put the data out later today, is that the hospitalization rate as a percentage of the total cases is actually going down. And it looks like the death rate is as well. You have to look at that on a sort of 10-day lag, because the time to death from hospitalization is about 10 days. But it looks like the death rate and the hospitalization rate as a percentage of the total cases is going down. And there's probably a number of reasons for that. Number one, older people and people who have comorbid conditions are probably doing a better job of protecting themselves. So more of the people who are getting infected are younger, healthier people. So they're not getting hospitalized at the same rate. And then when people do get hospitalized, first of all, a higher percentage are younger people. And that's certainly the case in Texas right now. 25% of people who are hospitalized are under the age of 30. But we're also doing a better job of preserving life in the hospital. We've talked about that before. But it's really going to make a meaningful difference heading into the fall. I think you're going to see death rates come down as long as we can protect the healthcare system and it doesn't become overwhelmed in these cities.